Hi, welcome to Physio Reading Night. We're discussing the book Assessment and Treatment of Muscle Imbalance, the Janda Approach. This book was written by Phil Page, Claire C. Frank, and Robert Lardner. Janda was a clinician, researcher, educator, and his theories of muscle imbalance gave him the title Father of Rehabilitation. Janda once compared his approach to Mendeleev and periodic table. Mendeleev created a system classifying elements in a systemic way of predicting their properties. He left blank spaces; he knew they must exist. They weren't yet discovered. Using a similar philosophy, Janda created a systematic, predictable approach to chronic musculoskeletal pain. So, who was Vladimir Janda? Janda was born in 1928. At the age of 15, he contracted polio and was unable to walk for 2 years. Eventually he recovered, walking functionally, but he developed post-polio syndrome and had to use book until he died in 2002. He finished medical school, then became interested in physiotherapy and received Kenny Physiotherapist certificate. He became more interested in pain syndromes of locomotor system. His first book, published at the age of 21, was on muscle testing and function, and it was the first of its kind in Czech. Before his death, he published more than 16 books and 200 papers on muscle function. At the age of 24, he is working in a rehabilitation center for post-polio patients. He was interested in evaluating claims in muscle testing textbooks using electromyography. He began studying muscle activity of the hip. He found muscles weren't supposed to be activated actually were, noting the accessory role of these muscles. Specifically, he found subjects without activity in the gluteus medius during hip extension used an increased pelvic tilt to accomplish the extension. This led to passion to study movement rather than individual muscles. This was beginning of thinking globally rather than locally. In the 1960s, Freeman and Week published on afferent input and mechanoreceptors. They described the use of football board in treatment of chronic ankle instability. Janda noted a connection between chronic ankle instability and chronic low back pain, its proprioception. This led to a sensory motor training. It's a progressive exercises using simple exercises and unstable surfaces. He rarely recommended strengthening exercises, instead focusing on balance and function. In 1964, Janda completed his thesis on sacroiliac dysfunction, finding weakness and inhibition of the gluteus maximus even in the absence of pain. He recognized that other muscles were prone to weakness. Janda subsequently defined movement pattern to estimate the quality of the movement. He discovered that muscle imbalance is systemic, predictable, and involved with the entire body. In 1979, he defined cross syndromes, his cross syndromes, the upper crust, the lower crust, and the layer syndromes. He noted that these cross syndromes were his only discovery. Humble Janda. He always gave credit for others. His influence continued to spread when he served as a consultant to the World Health Organization in 1960s and 70s. He also founded the Department of Rehabilitation Medicine and directed the physiotherapy school at Charles University at Prague, and continued to practice there until his death in November 25, 2002.